Welcome to Democracy 2018. We're taking a look at candidates running for different offices all across the state of Indiana. Right now with Tom Ferkinhoff. He's a Libertarian candidate for Congress in District 6. That encompasses 19 counties, mainly the eastern part of the state, a huge district. We spoke with you earlier this year already about issues that are facing the voters, and we also went to the fair and talked to voters. Well, we called them back since we're getting closer to Election Day and to see what kind of questions they have for you. So I do want to ask you a few of those. One voter I talked to says that he is more concerned about veterans affairs. He doesn't care as much about political parties, so he's really looking for a candidate who's looking out for our vets when they come home with health care and jobs. What are some ideas that you have for taking care of our veterans?
Yeah, and you know, one of the things we've talked about with the overall state of the country is just some of the unfunded liabilities that are out there, and like what we owe to our veterans is a big one. You know, that's not included in the official national debt. That we have this huge debt that we owe to our veterans, and you know, there's promises we made to these people that we need to keep. I mean, our VA system needs to be improved. And I think they have done some things. I've talked to some veterans that have benefited from the new bill that allows them to get care outside of the VA, where they live so far from VA facilities or need some specialized care. And I think we need to continue that effort and to make sure they have those. You know, I mean, for those that are serving, especially those who have served overseas, we need to make sure that they're acquiring job skills in the military that equate to when they come back out. And I think part of it, we need to stop the unnecessary spending on things the federal government shouldn't be involved in, so that we have the money for key things like taking care of our veterans.
Perfect. Another question that a voter talked to me about is the big issue of the opioid epidemic. And you've touched on this a little bit and using some Hoosier common sense ideas. This voter is saying we've had this war on drugs for so many years now, but it seems to keep getting worse. What are some specific steps you would want to take to combat this epidemic that's not only impacting Hoosiers, but really people all across the country? Yeah,
and I say it's not going to be an easy issue to solve. I say it's going to take a lot of grassroots efforts, continued efforts among a lot of organizations on local levels, you know, a lot of education still. And you know, one of the things we need to look at is, you know, why does our country have so much more of a problem than other countries? Why are people wanting to use in the first place? We need to get down to the root of that problem to try to cut some of that off. But then also, you know, we know that many people make the link through painkillers and opioids to begin with, and we do know that you know, they've blocked research on marijuana for so many years, and we need to get that off the federal Schedule A list and, you know, find the medicinal uses for that, because we do know there's a lot of non-addictive treatments out there that could be getting, and you know, a lot of that is getting some of the special interest money out of Washington, where the drug companies own the votes of some of our representatives. But I think there's just a lot of things on that level that we need to do to give people alternatives.
And you had mentioned last time we talked about that company out in Richmond that's offering some kind of treatment to people who can't pass those drug tests to get jobs.
Right. Belden Industries, if they'll hire somebody who fails the drug test and then they'll actually pay for their outpatient treatments and then monitor them as they go along, and they do what they can to help them to stay clean. And you know, one of the local drug consortiums that I met with up in Randolph County, you know, they had mentioned that their data shows that 60% of people would like to get clean. They're saying, you know, 40% of them, when they try to help them, they don't want to get clean, and they can't be helped until they really want to. And so, you know, like those 60%, you know, there is a lot that can be done for them, and particularly if they can get, you know, better jobs, because you know, a lot of times the only jobs they can get are very low-paying jobs, where they're not going to be tested or not going to be in any sensitive position. So, you know, in companies that are reaching out there, you know, they can do a lot more through the private sector than the government ever could do.
And you did mention marijuana. We know that's kind of a fractured law. It's illegal across the country, legal in certain states. Indiana is even taking a look at the medical marijuana issue. That's likely going to be an issue locally next session. What do you see as a solution to that problem if you were elected to Congress? Yeah,
and so the federal government needs to get on board. Congress needs to take action. They need to push to get it taken off of the Class A list. It's ridiculous that we have states where something's legal, but it's illegal federally, because you know, like all these companies that are dealing in marijuana, whether it's medical or recreational, they're all cash businesses, because banks won't accept their money because they're afraid their accounts are going to get seized, you know, through the Federal Seizure Act of drug funds. And I mean, the IRS out in Colorado has actually put in a major cash counting machine in a secure room, because these companies have to come in and make their tax deposits. with tens of thousands of dollars of cash. Their employees get paid in cash. And, even if Indiana puts in medical marijuana, well, CVS or Walgreens, they're not going to touch it because they don't want to violate federal laws, even though it's legal in the state laws. So then, what does that do to the cost if you have to have a specialized business that's all they do? And so the federal government just needs to get on board with that and give the states leeway to do what they want to do on the issue.
And you probably see kind of the tax issues as someone who works with taxes every day for your job.
Yeah, because there's things of that, like since it's not legal federally, then for federal income tax purposes, they can't deduct their normal operating expenses like other businesses would. And so, of course, that means of course, I'm sure the federal government likes it because they get higher taxes from them, but, higher taxes mean higher cost to the consumers. And once again, if there's medical uses for it, why are we driving up something that can be a better medical solution for somebody?
Okay, and changing gears now, President Trump has been talking tough on border security again as we get closer to the midterm elections.
Yes.
As a member of a different party, Libertarian Party, what would you do if you were in Congress? What sorts of issues do you support, and which ones are moves by him that you do not support? Yeah,
and the Libertarian Party does believe in open borders, but it's very difficult to have open borders when you have a liberal welfare system. So, we do recognize for the most part that there has to be an immigration system. We do need to change our immigration laws and do some updates there. And once again, just like the veterans made a promise, I think those who have been under DACA for so long were made a promise. And I don't think President Obama had the constitutional authority to do what he did with that program, but Congress didn't stand up to him. And I think there's a precedent that we should honor those promises that our country made to people. And so we need to move forward with giving them a path to citizenship. And we need to work to make ways for people that need to come to this country safely can do that. Our country has a labor shortage right now. There are people in El Salvador and some of these countries that are willing to come here and work, and they shouldn't have to make a dangerous journey where people are dying in the deserts of Mexico or having to be enforced by drug cartels to smuggle in drugs, when we could use our embassies and our consulates for employers to recruit people and bring them here safely and if they improve their families and bring the much needed labor into the U.S.
Okay, and my last question is just as we're getting closer and closer to Election Day, I know you're canvassing the district, talking to voters in all different counties.
Yes.
What are you seeing right now as the biggest issue that keeps coming up?
Really, one of the big things that keeps coming up is the medical situation with health care, and nothing that the government has done has really done anything to impact the cost of health care. And as I've talked to a few physicians and looked at different ideas that they have, and I think that we should be able to sit down in a room and get rid of some of the regulations that affects them, some of the regulations that run up cost, and work more on the cost aspect of things, to allow doctors a little more freedom and hospitals a little more freedom in their treatment, and work on that end as opposed to regulating and trying to have government-sponsored insurance companies and required regulations.
Okay, well, again, Tom Ferkinhoff running for Congress in District 6 for Indiana under the Libertarian Party. Thanks for joining us.
Well, thank you, Lauren. Thanks for having me.